So my name is Kathy, and my husband's name is Andy, and we have 2 boys. Our oldest one is Andrew, and our younger one is Luke. We live in an amazing community within the state of Texas. And not only are the schools amazing, but we've been able to build good relationships with our friends here, especially with Luke having special needs. Luke was born with bone marrow failure. I was an Army pediatrician when I got out of medical school, and also did a few years in the reserves. My younger son was born, and due to his medical issues, I wasn't able to go back to work. So now I just am full-time stay-at-home mom. I handle all of his medical issues, his appointments, and just really try to stay involved in the school so that way he can get the most out of his education. On the day Luke was born, I had gone in just for a routine checkup because he was running a little small. We noticed within 2 weeks of the last screening that he had signs of something called hydrops, which basically means all the fluid within your blood vessels rush out into your tissues. So within a very short amount of time, I was rushed to the hospital. Initially, they thought it was due to the placenta, but he has some other abnormalities that were consistent with something called Diamond Blackfan Anemia. And initially, that's what I thought he had, just being a pediatrician in the background. But due to the fact that he had no facial abnormalities, they were leaning towards the placenta being the issue. But at the time of his discharge, right before, his blood level started to drop again, which is consistent with the bone marrow failure. With Diamond Blackfan Anemia, it's traditionally a pure red blood cell aplasia, meaning the bone marrow is not able to make blood. They saw that he was beginning to crash. They told us to prepare for withdrawal of care because of how sick he came out. Luke has the most common mutation with ribosomal 19, and with that there is no cure. The only thing is treatment. So initially it starts out with blood transfusions to maintain your blood counts. Due to his inability to handle the amount of blood transfusions that he was having, the doctors decided that the best course of action would be to do a bone marrow transplant using bone marrow donation and also cord blood. Luke was enrolled in a clinical trial in Seattle for the bone marrow transplant. And it was during our discussions with Dr. Burrows, who ran the clinical trial, children that had bone marrow and cord blood seemed to be doing better with the results of their bone marrow transplant. And when she found out that we had saved his older brother's cord blood and that his older brother was a perfect match, she was very ecstatic and hopeful we'd have minimal complications and that he would have a better outcome. My husband and I are both physicians, and so we're keenly aware of the importance and just the blessing that our older child was a match for our younger child. Prior to Luke's bone marrow transplant, we essentially lived at Texas Children's Hospital. By the time he had his transplant, he had over 80 blood transfusions, and that was a full day event. Since we had the bone marrow transplant, including the cord blood, he now lives his life as a healthy kid. He finally learned what it means to be healthy. Being a pediatrician, it takes a completely different feel when it's actually your loved one or it's your child. You really understand how important it is and how life-saving the ability of having cord blood for use is, and it can make a world of difference. Cord blood banking became important to me when I was pregnant with my first child. So I had a conversation with a former colleague who's a pediatric hematologist-oncologist about her opinion with cord blood banking. And with talking with me specifically, she said because of my mixed race background and with my children being even more mixed race, that was something that she would recommend because she said that it would be harder for me to find a match or for my children to find a match. I knew the importance of having cord blood if I ever needed it for medical reasons for my child, any other children I had. The initial thought of banking with ViaCord was after discussion with my OB. When I first called ViaCord, I had many questions. The representative I talked to was very patient, explaining in depth to make sure I understood and the process if I ever needed to use the cord blood. Feel very confident in their ability to help our family. As a family, we love spending time together. We also like spending time with our extended family, whether it's just hanging out, enjoying the weekend together. Our older son loves Kung Fu. He's actually very good at it now. Our younger son, Luke, is just a bundle of joy. Despite all of his medical issues, all the hardships he had endured, he is always smiling. He's always joking and just looking for a reason to have fun.
My brother Luke, he's a very kind and caring, loving brother. I stepped in to help him because, well, I'm his brother. They got my bone marrow and they also used my cord blood to treat my brother. So I'm happy that I was able to save my brother Luke, being that hero that everyone needs.